We have over 30 million Americans who are or underinsured. We have over 40 million Americans who are living at or below the federal poverty line. The average cost of a one-bedroom apartment in the US, $1,200 per month. We have cities that have new industries and businesses moving in, new people moving in fact, and the community members that have lived in these neighborhoods for generations can no longer afford to stay. Or maybe it's the rural community and the industry that's been at the economic center for that region for as long as anyone can remember closes with little warning. What are those folks supposed to do? What if you're a 75-year-old who's living on the outskirts of town and you have limited resources, you don't live near accessible public transportation, and you need a shower bench? Why? Because you've had several falls, and now you have hospital bills you can't afford. Who is she supposed to call? Or what about you're a 30-year-old single mom, and you are low on diapers and formula, and payday isn't for 2 more days. You have a promising job interview coming up, but you can't afford the child care. So who is she supposed to call? So I want you now just to close your eyes for 1 second, and I want you to imagine think about the last natural disaster you remember. Maybe it's Puerto Rico, maybe it's Haiti. What did you feel? And what did you do? Likely, your first response was, I have to do something right now. I'm gonna get on social media. I'm gonna connect with my peers, colleagues. What if your organization, maybe you guys partnered with another organization that was raising funds or holding a drive? So you did that with a sense of urgency, and why was that? You saw basic human needs going unmet on a large scale, and you felt called to act, to respond. So when you think about your community members, do you have that same feeling when their needs are going unmet? So who do they call? They likely will call a government agency. I worked as a service coordinator. I took those calls from our community members. And I heard the desperation in their voice when they would cry out for some help, somebody to pull them back from the edge. And sometimes I was able to refer them somewhere. Sometimes there was a program that fit their needs. Sometimes not. Have you ever had to tell somebody they weren't home enough, not poor enough? I have. And so I was left with, well, I got to look for some organization that may be able to fill that need. And so I would look to the nonprofit community in our local area. Who could best serve their need? And so I would pull up a map, and I would find an organization that was in that area, and I would refer them. And on the map, it looked like their house wasn't very far from that resource. What we couldn't see on the map was that their apartment was on the other side of a highway from the bus stop they'd need to take to get to that resource. I couldn't see what their barriers were. Sometimes the barriers aren't captured with data, with numbers. You have to talk to the community members. So I want to talk to you about what I'm doing now. I work for an organization called Global Links. They're a medical surplus recovery organization. It's a nonprofit. They capture medical surplus from the hospital sector as well as the community. They've been working for over 25 years improving health outcomes in resource-poor communities. They've been working in Latin America and the Caribbean, and they had the brilliant idea, is there some way we could help our local residents with that same surplus or maybe some other items local folks might need. And so I came in as the first-time program manager, full-time, working for the Community Partners Program. And I wanted to take all of my frustration, all of the sadness I heard day after day, and do something about it. So my strategy that I came up with was, I'm going to map our community. I'm going to look at all of those neighborhoods that I got all those calls from. How can I get those supplies into where the people need them? Not make them take 2 transfers on a bus they can't afford in hopes that maybe they can get some assistance. So I looked out into the community. I talked to community members. That's who can tell me what the need is. I know what the data says. So I had meetings with community members. I had meetings with not just the big nonprofits, but the little guys, the community-based organizations, to hear how are they struggling to provide services. And so we started some distributions going to those areas, and it was a targeted approach because poverty doesn't look the same everywhere. What works on the north side doesn't work for Homewood. What works in Northview Heights on the north side doesn't work for Manchester, which is also on the north side. We have to have targeted approaches. So these partners were willing to grab my hand to figure out how can we work together to serve our community members. So, what if remember that 75-year-old woman who needed that shower chair? Well, that wasn't a made-up story. That was a real person. And we got her that shower chair. And how did we do it? Through collaboration. Through not looking at each other as competitors. We're a team. What if we changed how we look at the nonprofit sector? What if we change the order in which people call for help? What if they were able to just walk down the street to the local safety net organization that's there, that knows them, where they're comfortable receiving services? Wouldn't it be great if nonprofits in one neighborhood knew what everybody else was doing? Or what programs they had to offer? What if there was overlap? What if there was a better way, a targeted approach for that neighborhood, not our whole city? Start small, work our way to larger systems. And so my hope is, because we are partnering, I have 25 partners that have reached out and grabbed my hand, 25 of them. And we're gonna keep growing. But what do you all have to offer? How can you collaborate? What are your skills and talents? What does your organization do? Have you called your other partners in the area? What if we had more funding opportunities to encourage us to collaborate, to make it easier to collaborate? Our job as nonprofit leaders is to clear a path for the voices of our community members. It's not what I think the need is. It's not what everybody in this room thinks the needs is. What do the people in need actually need? What are these neighborhoods? What are the programming that they need? We can't work in silos anymore. We can't do it. These community members are in a crisis right now. This is our disaster. We have to step up and be the first responders. So I'm asking you all today, look to the person to the left and right of you. Network, talk about what you do. Where are you from? And how can we join as a team to tighten the safety net? Thank you.